Good morning, this is Dr. Duresti with the cranial release technique, and I just watched a video by Dr. David Perlmutter of the Grain Brain, and in his YouTube he was talking about how C-section deliveries leading to obesity later in life. And I found that to be a very interesting topic because for those of you that have been following the cranial release technique and our teachings, we always discuss how during the birth process, as the baby's head passes through the birth canal, that pressure that's exerted as the baby's head is leaving the birth canal, which is normal and natural, is what kickstarts what we call in the world of cranial work the primary respiratory mechanism. This involuntary pumping mechanism of the cranium, which is normal, which is natural, and C-section deliveries interfere with that normal compression and decompression. And so I find it very interesting that Dr. Perlmutter's research is leading him down the road of that the child is not passing through the mother's birth canal and the child is not being exposed to the microbiome, to all the good bacteria in the birth canal. And that's what's causing the problem. What I'm supposing here, what I'm proposing is that due to the C-section and the lack of the compression, and then the decompression, that is therefore causing an insult to the central nervous system. And by the way, I understand absolutely sometimes C-sections are needed and they're life-saving. But his research is showing the interesting correlation between C-section deliveries and obesity. And in my experience, and experience of other practitioners in the world of cranial, due to the C-section not allowing this cranium to have the compression and the decompression, it's as if almost the table is set for dysfunction later in life with the child. If you'd like more information about cranial release and how cranial release can help you in practice with this 1-minute technique, which can now reset the cranium, so even if the child has experienced a C-section delivery, there is a way through cranial release to restart this primary respiratory mechanism again, so that you're now almost reenacting the birth process from however age, whether it's just a few days old, whether it's a few months old, whether they're a few years old. So I would highly recommend, if you're interested in learning more, visit our website, cranialrelease.com. Click on the free report button, order a free report, learn more about cranial release, and then if you're interested, obviously there are other ways to learn it. Learn the technique, which is also on the website at cranialrelease.com, and that would be the button that says online training. So I want to thank you very much for your time and watching this brief presentation. I will put the link below for Dr. Perlmutter's YouTube video that I just watched not long ago. And it seems like we're all on the right path here, which is how do we optimize the physiology of a patient? And in my mind, it begins at the birth process. It actually begins at the pre-birth, in mommy's womb. How is mommy's cranium? And is mommy's cranium distorted, which is causing a distortion of the spine, which is causing a distortion of the pelvis, while the baby's in utero? So to me, the best time to apply cranial release is obviously to the baby right after delivery. Better than that would be to mommy while she's pregnant. And of course, even better than that would be to mommy and daddy pre-conception. Thanks so much for watching this brief video. Have a fabulous day. cranialrelease.com